Well, welcome in. We are with Dr. Ifusi. We are at Piedmont Arthritis Clinic. How are you today?
I'm doing well, thank you.
A Mainer. I'm tickled to death you're from New England, the great state of Maine.
That's
Came
right.
all the way down south with a wife and 3 kids.
That's right.
What's the first thing you do for someone with an appointment if you think they have rheumatoid? What do you do first?
So often our patients are referred here, usually from a primary care provider, sometimes a different specialist, maybe an orthopedic surgeon or bone specialist. And often the complaint is joint pain. The joint pain can be from a multitude of diseases, not necessarily just rheumatoid arthritis. So,
but now we won't always think arthritis with older people, but rheumatoid is it's congenital, isn't it? It's hereditary, and it can start at a young age.
Rheumatoid arthritis, if you have a family member that has RA, it does raise your risks some.
There are some things that those of us that are having pain and don't really have a full diagnosis, which we can get from you, some things maybe we can do to help with our joints before we see you.
Yeah, you know, I highly encourage people to kind of examine their life, their lifestyle, and what they eat and drink. It can be as basic as that. A Mediterranean diet is the most, the best diet that can help with inflammatory arthritis and a multitude of diseases. And food can actually be used as medicine. A lot of cold water fish, salmon, tuna, herring, things like that. And the unique thing about those fish is the density of omega-3 fatty acids, and that has really anti-inflammatory properties that can help arthritis.
Now you can get the fatty acids into your body with pill form.
You can too, and so some people, you know, can't tolerate the taste of fish, so a supplement. Some studies have suggested it can be impactful in people with arthritis.
Well, I told you my personal story. My grandmother had rheumatoid, and this was way back, and she would take an aspirin-related product, and which led to ulcers. And I mean, I'm assuming it's not good to take too many things like aspirin, Advil, acetaminophen, or what have you. I mean, some of these can lead to worse problems, can't they?
Yeah, so aspirin and the NSAIDs, so things like ibuprofen or naproxen, Aleve, they can irritate the stomach lining. And then some people are on blood thinners for different conditions, and that's potentially asking for trouble with gastrointestinal bleeds, and also people with kidney disease should avoid some of those drugs as well.
Now you do treat other things though, right? You look into other areas.
Yeah, so a rheumatologist is essentially a specialist for a collection of autoimmune diseases that typically affect the joints, but can affect, honestly, any organ system, the skin, the lungs, the kidneys. And so we see patients for a variety of problems, not just joint problems. And sometimes the joint problems come along with a clinical manifestation of other problems. But yeah, we evaluate the person, we hear their story, we try to tease out the distinct features of some of our rheumatologic diseases to see if what they are reporting, what their symptoms are.
Now, I think we mentioned lupus. Is that arthritis related? I didn't
Lupus
realize
is
that.
another autoimmune disease
Yeah.
that falls under the purview of rheumatologists. Typically found in younger women, but also can be found in men, but can involve any organ system of the body.
This is a Piedmont Arthritis Clinic. We're in the Bon Secours building, but you're in Greenville, private practice, of course, and we can call and make that appointment, right? It's easy enough?
That's right.
All right, Corey, thank you very much.
Yeah.
Nice to meet you. It's a pleasure.
Thank you.